My name is Benny, Dr. Benny Joseph. I am the Chief Executive Officer of Jubilee Mission Hospital, Medical College and Research Institute based in South India, in Kerala, Thrissur district. Affordability in healthcare is becoming a big challenge because of the manpower cost, the operational cost and the technological advancement that is creeping in the healthcare system. So it's becoming a big challenge for us. The resolution could be to reduce, to focusing more on clinical outcome and not give as much importance to patient experience as for clinical outcome. I think clinical outcome is a priority. I don't have a standard solution to reduce the cost of things, but focus on your clinical outcome first. Patient experience can come later. That's my one thought about it. Yeah, I think that's a big mistake that we say that always quality comes with price. Quality need not come with price. Before this accreditation that were there were quality, patient outcome happening. And quality of patient outcome always doesn't require large level of technology investment. It's a kind of a, it need not be always, together. So you invest on technology depending upon the situation. Don't assume that every technology will bring in, quality outcome. So invest on quality, invest in technology if it is going to mainly make a huge impact on the clinical outcome. We started in 1951 as a small clinic with a small 20 bed, and the context was at that time there was no affordable hospital for the poor people in my locality, Thrissur. So this was even known as a poor man's hospital. It was started in 1951 with a 20 bedded hospital. Fast forwarding, this 68 years, we are today one of the largest private hospitals in this part of the country, in southern part of India. We are 1,750 beds with around 2,000 plus outpatients per day. We have a medical college where we have undergraduate, postgraduate and super specialty programs. Apart from that, we have nursing college, nursing school, paramedical. Recently, we started Ayurveda, and our latest addition is a medical research center. We have more than 3,000 people working with us. Even today, our space is middle and lower middle class people. So we are a missionary hospital, a charitable organization focusing on the mission of transforming lives with love. So affordability, we are doubly cautious when we invest more in technology. I'm not against technology. Technology is required, but in the context of technology, we wouldn't want to lose a personal touch with the patients. So if a clinician can diagnose the patient based on the clinical acumen of the doctor, we would rather rely on that than looking at a lot of technological advancement. So we are able to maintain level of affordability, and in fact that's one of the vision statements that we have: affordable healthcare to all. Having said that, the last couple of years has been very turbulent, especially when the nurses' salary really hiked 120%. We went through a turbulent period last year. Even still, we have that recurrence of our financial problems. We are trying our best to make it affordable without really giving back the additional cost of healthcare to the patients. We are looking at a break even for our operations on a yearly basis. So affordability, to some extent, we are able to maintain because of that. If you look at the typical corporate hospitals, our rates will be probably less than 50-60% than the corporate hospital rates. Say for example, to give a clear parallel, a gynecology and a ward patient with a normal delivery, we can actually get discharged from a hospital with around 6,500 rupees, which is probably triple or quadruple times when we go to a corporate hospital in a ward. A C-section would be discharged with around 25 20 to 23,000 rupees. So our charges are very, very less when we compare to what's in the corporate world. Again, our future plan, there are 4 important agenda for us. We want to be quite advanced in terms of our clinical outcome. Second, again, patient experience. Third, education. And most importantly, our focus is on medical research. We have a very well established research center with all DSIR and Section 35 recognitions. So our focus is on medical research impacting the society. Some of the breakthrough researches, if I can take a minute to explain, we have a very well established burns unit in our place. And unfortunately, most of the burns patients come from economically poor or middle class people. And for them, having artificial skin, which is required as a part of the healing, is very expensive. So one of the breakthrough kind of findings that we have done, we have through tissue engineering, we have created artificial skin using placenta. So placenta is anyway not used. So we collect the placenta from different parts. We use tissue engineering and we have created artificial skin. I mean, it has been, phenomenal. I can go on and on. For example, recently we got an ICMR funding for a trauma project. And we are one of the 4 institutions in the country selected for this trauma project by ICMR Delhi. And what it entails is that I'm sure road accidents are increasing. And one of the major challenges that we see in the road accidents are people who rescue the patients from the road accident are not well trained. So a lot of complications arise when the patients are, the way in which patients are handled from an accident spot, taken to the ambulance, and how they are brought to the hospital. So we've done some study to find out how can we reduce the complications arising out of not professionally handling road accident patients. So what we have done is that we have created a protocol. We started training taxi drivers, ambulance drivers, auto rickshaw drivers on how can you carry a patient who met with an accident, how can we resuscitate that patient and bring it to the hospital. That's one study that we have conducted. A third study, which is again giving a lot of attention, is milking of the cord. Very interesting study, because the neonatology is a very strong department of ours, where we see that the premature delivery in the country is increasing. The premature delivery on an earlier stage brings in neurological complications. And there is one research that we focus on where milking of the umbilical cord, you cut the umbilical cord, you milk it back, brings in neurogenerations much faster, or not neurogenerations, but positive neurological impact for the child. So one of the areas that we focus is on medical. I can go on and on. There is another study that we are trying to float on zero blindness in some of the areas that we have located. Another study that we are going to look at it, how can we have a very strong geriatric department. We're going to look at how can we assess the risk fall of elderly people. So medical research is one area that we have a very strong focus on in the coming years.